My name is Dingaan Mithi. I'm the program manager at the Journalists Association Against AIDS. The abbreviation, we call it JournAIDS. So our organization, we are a media advocacy organization. We're based here in Lilongwe. We implement various projects around health and also sustainable development. From our own perspective as an advocacy organization, I think there are quite a lot of key challenges facing the Malawi's health sector at the moment, because recently Malawi government launched the health sector strategic plan from 2017 to 2022. It's a new 5-year strategic plan. And even the former strategic plan as well, which started in 2010 and expired in 2016. It had a very huge budget, but most of the needs were not met just because of the lack of funding. So lack of funding is a very huge challenge that Malawi can have ambitious plans, big strategic plans, but the huge challenge is the funding, because right now the space for donors to give the funding is dwindling each and every day. And that is a very huge concern for us as well, because this is derailing healthcare for Malawians. And if even you look at our central hospitals, the three Queens in Blantyre, you have Kamzu Central Hospital, and then you have Kam Central Hospitals. These three main central hospitals were built a long time ago, but they don't move in time. They don't go in line with the booming population, because Malawi's population growth is just going rapidly. Because right now, Malawi, we're talking about 17 million people, but maybe the time Kam Central Hospital, for example, is being built, Malawi maybe population was around maybe 6 to 7 million, but it's the same facility. So because of lack of funding, Malawi is failing even to boost its infrastructure in terms of the health services. How can Malawians access good health services if we are not having very good infrastructure? We have weak funding levels. This is a very huge challenge. And apart from that particular challenge, the other key challenge is the human resources for health. You see, most Malawian health workers who are trained, Malawi government is training a lot of health workers, but yet it can't even employ them. Most of them at the end of the day, they go outside the country, they go to the UK and they work in other countries. The situation we call brain drain. That's a very challenge. Malawi government invests a lot of money to train these health workers. In the end, it can't employ them. What do? They leave. They have to go outside the country. So that's another key challenge. So the lack of funding, dwindling donor support, the human resources for health. To us, these are the two key issues we look into to be very huge challenges. But when we come to priorities, I think right now the key priority we are looking at, I think it's non-communicable diseases. Why am I saying NCDs? Because for a long time, Malawi has been dealing with the HIV epidemic and also even TB, which have been quite challenging. But now, with the coming of ARVs, Malawi has recorded very huge successes. Right now, Malawi is implementing what we call the 90-90-90 strategy, the 390s, whereby they want that by the year 2020, 90% of the people know the HIV status. 90 of them are started on ART. Immediately they get tested, they know their status. And also 90 of them, they get their viral load suppressed. So Malawi is doing very well. But now we have a very huge challenge of non-communicable diseases. For example, diabetes, you have cancer, you have heart diseases, epilepsy, and many non-communicable diseases which are causing a very huge challenge to Malawi right now. I think this should be a very key priority for Malawi, because right now these diseases, if you look at them, they're very difficult to treat, they're very expensive, they're chronic diseases which don't have cure. Anyway, for example, diabetes has no any cure. It means people have to be on a strict diet. Now you look at issues to do with food security as well, goes into it. Nutrition comes into it. Malawi also needs very good medication, new technologies, well-trained health personnel. So to me, non-communicable diseases are a very huge key priority Malawi needs to look into. And that is why the new sustainable development goals that we've included non-communicable diseases, NCDs, so that at least by the year 2030, we reduce the burden of NCDs by 70%. To me, that's a very huge challenge for Malawi. The key government policies as far as the health sector is concerned, we are talking about the health sector strategic plan, because this is the biggest health policy for Malawi, apart from others like for example, Malawi Growth and Development Strategy. It's a growth and development strategy, of course, but also It also has very good aspects looking at health. We also have the roadmap on maternal health. That's another one. And also you have the one policy on non-communicable diseases as well, which are expired. Right now, government is working on a new national action plan to deal with non-communicable diseases. As far as I'm concerned, I think these are the key ones. There are many. For example, the strategy for accelerating childhood health. There are quite a lot I can mention, but I think these are the key ones. The health sector strategic plan, I think, as far as I'm concerned, is a big one. Apart from others like maybe the Malawi TB the strategic plan, the Malawi HIV prevention strategy, and also the national HIV strategic plan. I think these are the key ones I can mention for now. Sorry. The key structures and systems for the health sector, I think we are looking into issues, for example, structures, for example, you look at the community level, for example, you have health facility advisory committees, which are normally interface between the communities and health facilities, how they provide health services to the people. These are very important structures at a community level. Other structures, you look at the local governance structures, for example, the area development committees, village health committees, the village development committees. These are very important structures which play also a very huge role in improving Malawi's health sector. But most of these, when you look at them, they've got a very huge challenge of training. They lack capacity. That's why they cannot move forward. And most of the, for example, health facility advisory committees in the communities, most of them will find that maybe they've got maybe very old committees. Most of them haven't been trained, but they are quite very important. For health projects, the key players, for example, you look at the civil society. To me, when I'm talking about the civil society, I'm looking at different NGOs who are playing a very huge role in the health sector. Others are doing advocacy, others are doing awareness, others are directly involved in service delivery in the communities, providing maybe condoms, doing community outreach. There are quite a lot, but civil society, to me, I look at it to be a very key component of Malawi's health sector as a very important key player. But also we look at our health facilities, for example. They're also another very key player because they interface with the civil society. And also the faith community as well. For example, you have the Christian Health Association of Malawi, the CHAM. They run their own mission hospitals. They're a very key player because most of the health services in the communities, they are provided by the faith community through the CHAM facilities. So the faith community, the civil society, I think they're also very, very key. Apart from others, for example, members of parliament, policymakers in government, the private sector, although to a small extent, because private sector have also a very huge role to do with in the health sector, although we haven't engaged them very well, but they are quite also very influential. For health projects, I think basically the do's and the don'ts. I think one, we need to talk about consultations. When these projects are being developed, I think sometimes it's important to do the analysis, look into the policy environment. I think it's very key before you develop another project. I think you need also to examine, because if you don't examine very well, most of the projects end up flopping, they end failing if you haven't done a consultation. So it's always important to do consultations, do policy analysis, study the environment, what are the gaps. Like right now, Malawi is being faced by the huge challenge of non-communicable diseases. Yet you find that many organizations are not very much interested to do non-communicable diseases. They would rather go to other areas, maybe HIV prevention, which already has been covered. Of course, HIV is still a very huge challenge, but in non-communicable diseases, look at the evidence there outside. It's a very huge challenge which most civil society organizations, government needs to put more priority. So I think for setting the priorities right, designing the projects, putting all the projects on the ground, I think it's very key that when you're developing new health projects, you look first into the policy environment. What is the space? What are the key challenges Malawi is facing? So we need to do a very proper analysis, do several consultations. I think it's also very key so that we develop projects which bring results and impact in the end. For governance, basically, I think we need to look into issues to do with transparency and accountability, because one thing I've noted in terms of governance, we found that Malawi has got very has got many structures, many governance structures. For example, you have the Cabinet Committee on Health, which sits on top of government. But how this interacts with other committees, maybe going down, like maybe into the community, the Malawi Local Government Financing Committee, all these, they need to link up very well. But I think the problem sometimes is that these different governance issues like transparency and accountability, the structures which are in place, they're not speaking to each other very well, which is also giving a very huge challenge to our health sector as a country. But I feel the governance issues we're having, basically, you are looking at it on how we are governing our health sector in terms of transparency and accountability. How are we managing our health sector? How are the ministries are linking up very well? For example, we have got the Department for HIV and Nutrition, which is a very good governance structure. You have the Parliamentary Committee on Health. And then you go to some parliament to find that maybe there's also another governance structure. For example, the Parliamentary Committee on HIV and Nutrition. Ideally, maybe these need to be restructured as governance structure so that Parliament becomes more responsive to issues to do with health, so that maybe the governance aspects in terms of the Parliament itself is more responsive. And also you go across all the line ministries, you find that health, to me, is a cross-cutting issue. Health goes around each and every ministry. You can't talk about health. You can't live outside health in any sector. But we find that maybe our governance structure in terms of how health is mainstreamed across all these ministries, for example, the Minister of maybe Foreign Affairs, where is health located? You find that maybe it's not even yet there. Health is not their business. Minister of Justice, definitely we have to talk about health because people maybe whose rights have been violated. For example, maybe minors, juveniles, they're talking about even child rights, children, their health has been compromised. They need to look into these things. So I think somehow our governance, maybe in terms of the health sector, needs to be revisited, I think somehow, so that maybe we can make an impact. But there are a lot of governance gaps.